All right, number 8. Boy, we're blowing through these as fast as I can here. Sorry, guys. Number 8 is going to be talking about the upper respiratory infections, and again, these guys can cause some major problems. All right, and what we're talking about is these diseases get worse due to a pulmonary infection. Usually, this is your sinusitis. What they usually end up doing is dripping down towards get in the lungs, and then again, they usually end up giving you a lower respiratory infection, which of course is a problem. Again, the best defense: cover your mouth and nose. Good hand washing. That's probably the best way to stop it. And we all know the use of the mask, right? So again, and viruses are a cause of most of the upper respiratory infections, and there are some bacterials. Streptococcus count for about 30%. So again, it's a self-limiting illness. You get fevers, chills, you feel bad, you get tired real quick. Sound familiar? Okay. So again, the diagnosis and treatment is based upon history and physical findings. Okay. Usually, we don't usually intervene with any of these. Children with epiglottitis, or if they got a complication where the pus may occlude the airway, if they got a really bad in the back. I've seen some of those where they've actually had to do that. Most of the time, what they usually end up doing is breaking their own pus pocket, and so you probably have to sit there and suction that stuff out. And that can be interesting, and usually I hand that to the patient and teach them how to use a little finger thing on the Yankar, and I let them suction it out because they know right where it's at, and then they don't go so deep that they actually cause themselves to hit their gag reflex. Again, supplemental oxygen is usually all you need for these guys. Again, acetaminophen or ibuprofen for the fever, the headache, drink plenty of fluids. Salt water goggles, you can use those for the throat discomfort. I'm more of a fan of taking the chloroseptic to it. You give yourself some numbness for a couple hours. It usually works pretty good. Decongestants, antihistamine reduces the mucus secretions. Encourage the patient treated with antibiotics to continue those. If they were prescribed antibiotics, which God I hope they made sure that it was bacterial and not viral. Remember, antibiotics don't work on viruses, okay? They just don't, all right? Two different types of things. Antibiotics work on bacteria, all right? So don't remember that, all right? Pneumonias. Again, infection of the lung. Usually older people get this, really young peeps. Those infected with HIV, they get the opportunistic infections, which again, that's their leading cause of death in both the groups. 5th overall cause of the death in the United States. Again, usually your HIV patients end up with AIDS. This is how it's part of the end stage process. Leading cause of death in both groups again, and the risk factors are alcohol. If they got a history of alcoholism, cigarette smoking, if they were exposed to cold temperatures, they're probably prone to a pneumonia. So again, usually you get defects in the mucus production, ciliary action, or both. And the bacterial and viral pneumonias are the most frequent. You get some fungals in there every now and then. But again, that's why they need the sputum sample. They'll culture that sputum sample, figure out what's growing, and then know how to treat it appropriately. Okay? So again, a bronchopneumonia, usually this is all over the place. Affects a little bit of the air sacs. Lobular pneumonia will just actually collapse actual lobe. If it gets into the interstitial spaces, it can affect actually all of them, okay? And again, the problem is that the irritation of the lining, it dries it out and infects them, and you don't get a good gas exchange. They start to kind of swell, they'll puff up, they don't work right, okay? And the infections can include the entire lung, by the way. And remember, as it gets infected, it likes to swell, and that swelling causes leakage of fluid into the alveoli, and then the alveoli end up collapsing because of it. And again, it's primarily a ventilation disorder. It's not a actual gas exchange. You got to get the air going in and out and then fill those air sacs. Patient got a history of fever and chills. Again, a productive cough, yellow to brown sputum, and it's often streaked with blood, usually because of the trauma of coughing, okay? And it can have pleuritic chest pain. Every time they cough, it hurts, okay? Again, fever, tachypnea, tachycardia, cough is all the things that happen. Auscultation of, again, the chest crackles. And then your diagnosis, again, x-ray is probably the best way. And then they usually, again, they'll culture any type of sputum that does come up. Again, antibiotics is usually your primary treatment, or antiviral, antifungal, depending on what they find out is causing it, and apply supplemental oxygen, okay? If they do have, by the way, a viral or a fungal pneumonia, not that all of them, you should have your respiratory equipment on, okay? Even bacterial, you need to have that respiratory equipment on, especially your N95. I can't stress that one enough, okay? Again, severe cases, you might have to actually ventilatory assistance or actually intubate them. Especially in our COVID world right now, I think that we know very well that that in a way, when we're putting them on ventilators, I hate to say it, it's kind of a death sentence for them, because they just, even though they get the ventilatory assistance, usually the lungs are so damaged, it damages them to the point where they're no longer usable, at which point, again, they continue to become acidotic, they get weaker, they get worse, they get bad, they die, okay? Again, we usually give them some sort of antipyretic agent, Tylenol or Motrin, to reduce the fever for these guys, okay? Again, patients over the age of 65, I want you to make sure that you understand this. So if they're doing the cough, fever, feel, and malaise thing, again, a high mortality rate. We really need to aggressively treat these folks. And for God bid, don't get a refusal, all right? Hunter, I'm talking to you. All right, so again, transport to the facility capable of handling the significant complications of the disease process, all right? Now, we got some variations of specific respiratory diseases. COVID, SARS is actually a form of COVID, by the way. First appeared in southern China in November 2002. Interesting. But again, the SARS-associated coronaviruses, but these, by the way, it's not only China where these things are coming out of, by the way. It's coming out of the Middle East. It's coming out of Africa. We've had strains come out of Maine, as a matter of fact. So it's not that it's just associated with those. Again, it's spread by close person-to-person contact, and it's got a 2 to 7 day incubation period. Okay? And it's very contagious. Again, you should be wearing all your PPE. And the first sign of severe respiratory distress, that's usually it. You got to address those early, okay? And again, this is the chest ray of a lung cancer. This is where you have lung cancer issues. I don't know why exactly that slide's there. The lung cancer should be back where there, but usually when we get a SARS X-ray, it's usually full of white stuff all through there, okay? Again, the air is normally black, okay? And in this case, the lung cancers, there'll be tumors. We'll get to lung cancers here in just a minute. So again, they have underlying diseases. Again, they start out with mild symptoms, and then they'll eventually, and it can lead up to something that eventually leads to respiratory failure. Again, correct the hypoxia, supplemental oxygen, establish an IV, and in severe cases, you're going to have to provide ventilatory assistance and endotracheal intubation. Again, this is a severe case situation with SARS. Like I said, not only did it happen in southern China, it also happened in Saudi Arabia, Jordan. So again, the same thing, close person-to-person contact. And again, these evolved as well. By the way, when I said SARS, the severe acute respiratory system, is actually the basis, and you can see this slide, I can tell you right now, was made long before the current COVID-19 came out, okay? So that'll give you an idea how long these diseases have been around, okay? All right, that's it for these. We're going to start on the lung cancer here on the next slide. I'll see you guys on the next one.